Hello and welcome to On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we thank you for them. And now we're going to try to answer them. So let's just get started. Quick answers. 76-year-old woman from Sioux Falls would like to talk about her retirement communities. She comments that they're wonderful places to be with many physical and social activities. I agree. It sounds like a dear friend of mine from D. Smith, where I grew up. She is now in a retirement community. I think she's having a great time. Comments?
I think we all just say ditto.
Yeah,
That's it.
that's more socialization.
So socialization is very important. They say, okay, to prevent dementia, the most important brain exercise is not puzzles, it's conversation. Have you heard of that? No.
I haven't heard of it to prevent, but for depression, well-being and state of depression, you need to be able to talk in person to one or two people a day. Or
Every
something.
day.
Yeah.
It struck me while we were on the air too that when we were talking about assisted living in nursing homes, there are times when people go into them and their family has to start making appointments to see them.
Yeah.
You know,
Because
there's
there's
a lot going on.
I'm
They
just
aren't
so
that
busy.
bad
No.
if you need to be there.
85-year-old woman from Sheridan, Wyoming with type 2 diabetes has a constant central tremor. She has gotten vertigo about 3 times recently. Is there a relationship between the diabetes, the central tremor, and the vertigo? What do you think?
I don't know.
Nothing comes really quickly to mind.
I think not. I think the central tremor is a benign tremor. It's not Parkinson's disease. The diabetes, that you get that in non-diabetic and diabetics.
Yeah.
And then the vertigo. I don't know of any
I
connection.
don't know for sure. You can have, mononeuropathies, but I don't know about.
And you can also have very benign vertigo.
As a
And the worse
separate
it is,
issue, yeah.
probably the
more benign.
The more benign it is, if you get your head in the right position and things start to whirl, you sit up in bed and things start to whirl. If you
Roll
change
over in bed.
position
Yeah,
and
position.
it starts to whirl, then there are things you can do to train yourself to not have that happen. It's usually a piece of calcium or debris that lays up against the hair cells in your inner ear and causes you to think that you're in a different position than your eyes are telling you where you're in, and then your brain fights and you start to whirl.
Trying to figure out what's going on. It's
Right.
sort of like being in a sailboat in the
And you
ocean.
can see an occupational therapist and train yourself to ignore that.
Or go sailing. A 53-year-old woman from Rapid. Why is morphine the drug of choice for pain in the emergency room and hospital, and what are the dangers? Well, that's an interesting topic. How about narcotics in the elderly?
Well, they're quite problematic in most elderly.
Constipation really
right,
hits
right.
big time.
But of course, we also are mandated to treat pain, so we end up with a dichotomy of not
Yeah.
ignoring pain, but going to morphine first is not a usual standard.
Yeah, I've stopped using morphine.
Yeah.
I use either fentanyl or Dilaudid IV if
And
you need to do an IV narcotic.
There's a lot of concern about narcotics because it's a big problem. I can't remember who said how many people are using illegal narcotics in South Dakota.
It's just,
Is that-
yeah, it was we did
That
a
was
show
your
on
show.
it. There's a huge number of, and what they're doing is they're coming in, they're getting their pain medicines, they're going out and selling it because it's making their money
But what should happen is that you should first find out why the pain is happening, and then find out if there's a more appropriate and a shorter time frame to treat.
right. Perfect answer. 60-year-old from Pierre, what kind of respite care is there for caregivers? We answered that. Caller has high iodine. What can she do about it? I've not ever found high iodine. Have you?
I wonder why it was measured.
I don't know either.
I wonder if you
But
can.
we do know that if you have low iodine, then if you're a baby, you can get
Yeah.
cretinism, and if you're an adult, you can have a goiter.
Right.
And there are parts of the country that have not enough iodine in the food, and that's why we have it in the salt. Except that
Yeah,
some
I
people are
would-
not putting it in their salt, but too much iodine?
I would
never-
wonder if it might have been measured by someone who's not in the
Medical.
traditional medical field,
Right. But
like
I don't.
in hair or something like that.
Right. I'm not aware of any major disease from too much iodine. Well, there is, but unless you're
sure
taking
there
huge
is.
supplements.
There's a poison sign if you remember those old iodine bottles.
Yeah, right. There's too much.
Who drinks it?
Yeah, where would you be getting iodine?
Yeah.
Except maybe supplements. Actually, there is an issue about some supplements having too much iodine, but I've never measured a level.
No.
What is the expert's impression of Prolia for osteoporosis?
I guess it's one of the bisphosphonates. Or?
No,
it's
that's
a-
that
I-
shot twice a year, isn't it? Yeah,
Can you
Prolia.
see that? But
Ellen, you know
question
there's the.
It's it's a different
it's
mechanism.
it's a different mechanism.
it's a hormonal intervention, I think. I'm not all that
gonna
clear
pass
on it,
on
but
Pass
but
on that question, but
except that
you're not prescribing a lot of it, obviously, are you?
it works. It was released, and it's for people who have problems
With
with.
the bisphosphonates.
I think it affects the.
bisphosphonates and whatnot.
Yeah, it fits.
Isn't
It's part of the parathyroid.
It
or-
blocks the
Parathyroid
osteoblasts, osteoclasts from eating up the something like that. I have not prescribed it yet, but I do believe that there's a time and place for it. But you really want to make absolutely sure that there isn't a vitamin D deficiency, there isn't a calcium deficiency, there isn't some kind of hormonal problem that's causing this.
I've used it in nursing home patients who really could not tolerate anything orally.
Bisphosphonate. 64-year-old man from Alcester. Is there any correlation with prostate issues and lack of sexual interaction? In other words, if you don't use it, you lose it. What do you think?
I don't think so. Well, prostatitis.
I see exactly how that was.
Well,
Right.
here's the issue. I'm pretty sure as a guy who takes
Okay.
care of a lot of old guys,
Go with it, yeah.
and the answer is, if you're not being sexually active, you can't jump back into it and expect it to work. I do think that there's a time to check testosterone if someone is interested in sexual activity,
Right.
but there's some danger to it.
And,
But
and the question
but
is,
the prostate by itself, I don't.
and the question is, what kind of sexual interaction is the lack of sexual interaction? So, if it really is an erectile dysfunction, we've got medicines for that. It's usually not associated with
With
prostate
prostate.
problem, it's more with vascular problems. But if on the other hand, it's lack of sexual desires and whatnot, then testosterone checking and other things is appropriate.
Right. Anything about sexual function in women, older women, Ellen?
Well, I mean, it's more. They've been advertising more directly to people about the painful intercourse with the
medicine for
vaginal
that now.
atrophy. Yeah.
Yeah, lubrication
Yeah.
medicines.
But as far as desire, I don't know. They don't tend to give women.
desire medicines.
Yeah.
There certainly has
I mean,
not been
there-
as much,
You can do that, but
yeah, there's not been as much study as
Right.
in male sexual dysfunction.
No. 84-year-old from Sioux Falls. How do you control the pain of arthritis? That's the million-dollar question, isn't it?
it is.
I would say the most important thing to do is to get them moving. Bone on bone, people do better.
Yeah.
It has to do with
activity.
activity.
And you can use local treatments. Capsaicin, I think, works pretty well.
Which is,
hot pepper cream.
Hot pepper. And there's topical Feldine. Just
Have you used a lot of that topical Feldine?
some. Hmm.
Yeah. With success?
Yeah. But as far as going beyond the nonsteroidals is always like we're always kind of wary depending on how old the person is.
and even
because of-
utilizing the nonsteroidal,
Right.
you have to be careful.
yeah,
But
because of renal function.
the knee is special because there have been studies that show walking improves knee pain. Walking, two non-pharmacologic interventions are walking and losing 5 pounds of weight. Study after study has shown that those interventions are good, helpful.
There it is, a non-medicinal therapy.
Right.
Where can you get the exercise book? We've said that. We are finished with our our questions. I thank you both very much for
Time for
joining
wine?
us. Time for a break afterwards.
Is that on TV?
Yeah. Thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. And until next time, stay healthy out there, people.